Well, good morning, everyone. Welcome to the Animal Care Wednesday webinar. This is Amy Schleicher. I'm one of the committee members for the webinar series, and I'm filling in for Heidi Carroll as host this month. The Animal Care Wednesday webinar is a collaborative effort of extension services from 4 states: Iowa State University, University of Missouri, University of Nebraska, and South Dakota State University. So just a few details before we get started with this morning's webinar. Just a reminder, please mute your microphones or phones so we have less background noise. Thank you. And we definitely encourage questions. So the way that the questions will work today is we'd like for you to type them in the chat box as we go along, and we'll kind of keep our eyes on those. And if nothing else, we'll get them answered at the end of the webinar presentation. This session will be recorded and available on our website for later viewing. I put that link in the chat box, so you're welcome to go to that at any time for any of our recordings from past webinars. And then at the end, you'll see a screen pop up. That's a little survey that we're going to please ask you to fill out. We appreciate your input as we move forward with planning. And so again, if that screen pops up, please share your input if you would. So our topic this morning is an interesting one. Everyone here on the webinar understands the issue of antibiotic resistance and how the livestock industry has been impacted. And the One Health initiative that we're going to hear about in South Dakota is a collaboration between animal and human health experts to address issues like antibiotic resistance and zoonotic diseases in a multidisciplinary way. And so to visit with us about the One Health program, we have Dr. Russ Daly, South Dakota State University Extension Veterinarian, and Dr. Susan Anderson with the University of South Dakota Sanford School of Medicine. So welcome, Drs. Daly and Anderson, to the webinar, and thank you for your presentations this morning, and I will hand things over to you.
Thank you. This is Susan Anderson, and I'm happy to be on this webinar today. Dr. Daly and I are going to introduce ourselves and give a little bit of our background as to how we came to be involved in this kind of effort. As it was mentioned, I am a physician. I'm a family physician and am the chair of the Family Medicine Department at the University of South Dakota Sanford School of Medicine. I went to undergrad at South Dakota State University. I grew up in a small town and grew up on a farm. I still live in that small rural community, so I definitely am involved and have an understanding of the livestock industry. My family raises cattle. I was in 4-H when I was younger, and then I was a 4-H leader for a few years when my son was in 4-H, and so again have a understanding of some of the challenges and things that come up in rural South Dakota. And in 2012, I became the director of the Frontier and Rural Medicine program at the medical school, and that program has a goal to train future physicians in rural communities and frontier communities in our state, hoping that they will gain an understanding of the rewards and challenges of working in those areas, and then hopefully go back there to practice one day. And as part of that work, I got to know Dr. Daly and his efforts with the One Health initiative, and that's how I became involved. And so with that, I will let Dr. Daly tell you a little bit about himself.
Yeah, thanks, Susan. And my background is in veterinary medicine. I've been the extension veterinarian here at South Dakota State for since 2005. Before that, I was in a small rural veterinary practice pretty close to where Dr. Anderson actually lives in southeast South Dakota, and was always somewhat involved in zoonotic disease education and public health, kind of on a peripheral level. But about 7 years ago, I was asked by the health department in South Dakota to serve as the state public health veterinarian. We hadn't had one in that, a person in that role for many years in South Dakota. So I was happy to step into that role kind of on a consultative fashion. And one of my big tasks with the health department is to kind of help them understand some of the issues around animal health and where that intersects with human health. And so it's a perfect lead into the One Health initiative that we are undergoing in South Dakota. So I'll turn it over back to Susan.
Yes, and so the One Health initiative has been around for quite some time, and that concept actually dates back even to 400 BC. The appreciation of the interactions between humans and animals and the environment. And so there really is an integrated effort of multiple stakeholders and multiple disciplines collaborating and communicating and working on a local, national, and global level to try to attain optimal health for people, animals, and the environment. So, veterinarians often work in that sphere probably more than the other groups because they're a profession that routinely operates at the interface of all three of those components. And as the human population continues to increase and expand across the world, the connection of people and animals and the environment becomes more significant and more impactful. And one of the things that we talk about and that I feel that the medical community needs to be engaged in is zoonotic disease. In a rural state, like South Dakota, ag is our primary industry, and a lot of those folks are at the front lines, working with livestock, and the possible zoonotic disease, meaning a spread of a disease between humans and animals, is possible. And then there's also the possibility of vector-borne diseases, diseases that come from an infected host and then are carried through insects to others. And actually some estimates are that 75% of emerging and re-emerging diseases are either zoonotic or vector-borne. And so we need to have our healthcare professionals educated, and we need to have an open line of communication between livestock producers, veterinarians, and healthcare workers in order to try to attain that optimal health.
So we've known about the One Health concept for some time, as Dr. Anderson mentioned. So what does that mean for us in South Dakota? And hopefully in your own states, you can kind of get an idea how this works in your locations as well. But as Dr. Anderson pointed out, we are a big livestock state, a big agricultural state. So we have many more cattle in South Dakota than we do people. And so that creates opportunities for zoonotic disease from livestock to spread to those people who work with the livestock. We have a burgeoning dairy industry in eastern South Dakota as well, in which people are even in more contact with those animals as well. And what we've also seen with the agricultural aspects of life in South Dakota is more and more people, more and more operators are being interested in letting the public come to their farms. So we now have situations where people who haven't been used to the germs that have been that are normally present around cattle, for example, we have more opportunities for those people to be in contact with these animals. So that's part of some of our concerns and our efforts as well. We have like many other states, we have a big hunting culture. And I put this slide up to just remind us that besides livestock, wildlife are a big part of zoonotic disease and the potential for people to contact diseases as well. Maybe not so much the pheasants that we're seeing in that picture there, but consider that skunks are the main reservoir for probably one of the more prominent zoonotic diseases called rabies here in South Dakota. So we're learning more and more about the role of wildlife in zoonotic disease as well. So that's something that's a little unique to our state as well. And then we have the issue of poverty on places like our Native American reservations. Certainly there are pockets of poverty in our cities as well. So what does that mean for the interface between people and animals and wildlife and those kind of situations as well? So all of those things kind of make we feel kind of make our state unique with some different issues than maybe other states would have, but probably pretty similar in a lot of ways to a lot of other states as well. And so that's what prompted our One Health seminars. So this is a big part of our One Health efforts in South Dakota. These actually started about the same time that I started in the role of state public health veterinarian. It started with a pretty simple request from our health department to want to get together with the other state agencies that deal with animals and diseases. And our first meeting was a small one around the conference table in Pierre, our state capital, with the people from the health department and the animal industry board, in other words, the state veterinarian's office, SDSU, the labs, the wildlife agencies, people who really get along pretty well and work well together when it's needed, but don't really take the time to sit down and talk to each other when there's not a crisis going on. So that really proved very successful, and we took that to the next level, and it just kept expanding and expanding, and went to a situation where we opened these meetings up to the public. And so since 2011, we've done 12 different seminars on One Health. And what our approach has been is to pick one topic and really kind of delve into that one topic on an over the course of a day, but also to make it really applied. What does this actually mean for veterinarians? What does it mean for animal owners? What does it mean for people who are working in the local health department or a local medical clinic? We really try to keep things applied. So some of the examples, we'll kind of buzz through them on the next slide on the websites, but we've covered things like rabies, I mentioned. We have anthrax in our cattle in South Dakota. So what does that mean for public health? Diseases such as Q fever, tuberculosis, influenza, each one of those we've spent a day just diving into. But we've also covered some more kind of broader range topics, like for instance, we covered therapy animals and the health benefits that they bring to people, as well as some of the health threats we need to worry about. And so we actually had a therapy horse come visit one of our One Health seminars. These have been really, what I like the most about them is when we do our evaluations at the end, we usually find that the participants are evenly split between animal health interests and human health interests. For a lot of these topics, we can get a lot of buy-in from veterinarians and animal owners and livestock producers, and maybe not so much on the human health side of things. But we've been able to kind of craft our seminars to have topics that would be interesting to both. And whatever field these people live in and work in, they usually come up with a better understanding of what the other side deals with on a daily basis. So that's been the really nice part of these seminars.
And the next slide shows the website that we created. As I mentioned earlier, Dr. Daly invited me to be involved with this effort after the creation of the Frontier and Rural Medicine Program, or what we call FARM. And I think it was in 2014, he asked if I would speak at one of the One Health seminars about antibiotic resistance and stewardship, and how do we handle that on the human side of things. And then I also gave that same presentation at the state vet conference. And after that conference, one of the veterinarians from Eastern South Dakota came up to me and said, you know, how do we increase communication between veterinarians, livestock producers, and folks working on the human health side? And what we did is we applied for a Bush grant, and you know, the Bush Foundation likes to fund things, community problems that maybe you don't know what the answer is, but you're going to spend some time and some money to figure out what it is and come out with some type of solution. And so we received that Bush grant in 2016. It was a 2-year grant, and one of the outcomes from that was the South Dakota One Health website. And so this website really is a repository for the meeting archives. So if someone is not able to attend the One Health meeting, or they hear about it after the fact, but they're really interested in that topic, they're able to access the PowerPoints and the resources from that meeting. We also have other things on here, you know, directory of experts, folks that are involved in these meetings and give often have given presentations on a certain topic. And there's a blog or really kind of just a place for us to put up current articles or announcements about things that might be interesting to folks in public health or livestock producers. And so this is just a way that we can lead folks to resources and have it all contained. And you know, we continue to try to improve and develop this. So again, it's a way for us to share information. And also from that Bush grant, we went to different venues, farm shows, stock shows. We had magnets that gave folks the website so they could access that. We also did some surveys to find out how folks wanted to receive information. I mean, just speaking from my personal perspective, I have family that are livestock producers, and every time I go to one of these One Health seminars, I learn something, and I learned something that I think I should have known, but I didn't. And then I talk to my father or my brother or others that are producers, and I ask them if they know, you know, what Q fever is, or you know, some of these other zoonotic diseases, and how much should they know. And so we wanted to get information from the public as far as, you know, what their needs were and how they like to receive information. We also created the sanitizing stations. There's a picture in the middle of the slide. Those were delivered to all the counties for use at their achievement days, where there are 4-Hers, you know, working with animals, and the public comes and sees the animals. So there's some education on there about the importance of, you know, washing your hands and you know, the possibility of zoonotic disease. And then one of the largest things that we did is a educational display, and it's a portable display, and it's going to be in the pavilion as part of a series that they're having there from January until May. And again, it's educational for really all ages, and there's a microscope, and there's some other things that explains what zoonotic disease is, and the importance of hand washing and sanitation. And so we've tried to do things that educate the public at large, because as Dr. Daly mentioned, there's a lot of contact with humans and animals, and if we are you know, making a concerted effort to do good hand washing practices and that sort of thing, you know, avoid animals, whether it's livestock or wildlife that appear ill, we can hopefully save folks from contracting some of those possible illnesses. The picture on the lower right, Dr. Daly and I were on Keloland Living to give some publicity to one of the most recent ones we had. One of the recent seminars was about the companion animals and the therapy animals, and you see more and more of those in different locations in the hospital, in shopping centers, and really what are the rules and regulations about that, and what are the benefits and what are the risks. And so we're reaching out beyond just the veterinarians and the livestock producers and the medical providers to the public at large too.
And one thing along the lines of what Dr. Anderson was talking about, as far as our contact with animals in South Dakota, we have some pretty high rates of infections like cryptosporidiosis and E. coli, Shiga-toxin producing E. coli in South Dakota relative to the rest of the country. So some of these efforts are really targeted at what can we do to help the education surrounding those issues. So I'm just going to end up with talking about what we feel our impacts have been and a little bit about our future. We really do feel that these meetings have brought together people in South Dakota who normally, like I say, don't get to talk to each other on a daily basis, or when there's not something crisis driven that is going on. So we found that we have a lot of people now who know about a lot of animal health providers who know about the human health providers in the state and in their local areas as well. And we, in our evaluations, we've always come back with people having some good takeaway points on practical issues in our state, and usually issues that they're dealing with in some fashion, whether they're animal health providers or animal owners, or human health providers or health department workers as well. So the collaboration, I think, has been good. Not that it wasn't good before, but it feels like it's improved now. One other thing that I've noticed over the past few years is, as a state public health veterinarian, I get to belong to our national public health organization. And when we started kind of ramping up our seminar efforts in our One Health website and things like that, I had the very frequent comment from other state public health veterinarians that I wish we could do something like that in our state. And so what I've seen us in South Dakota doing is maybe kind of providing a little template for some of these other states' efforts. And I've got Idaho, Iowa, Arkansas up on the screen, but there's probably I know there's many more states than just that doing their own One Health symposiums and efforts as well. And I think one of the problems that we in the academic world and in the outreach world, we think of a topic like One Health, and it's so big and broad and all encompassing that we really want, we're tempted to kind of solve all the world's problems with one meeting. And we've kind of done the opposite here in South Dakota, as we just focused on what are issues that people are interested here in South Dakota, and then what practical things can they do in their own lives, in their own workspaces to help make these issues not so prominent anymore. So we've really focused on practical issues, and I think I in talking to some of the other states, we've certainly gotten that impression that having that local kind of targeted influence has really helped their buy-in from their own states. So we feel pretty good about what we're doing. We are still we are still doing the seminars. We've got 2 planned for this year coming up in 2019. We're going to revisit the topic of antibiotic use in animals and in people, and the interface with antibiotic resistance in those animals and people as well. And so we're going to target Western South Dakota for one of those meetings this year. We haven't done a whole lot in Western South Dakota prior to this year, so we're going to make a targeted effort to do that, along with maintaining our website and just keeping our ear to the ground as far as issues that people would want to hear about here in our own area. So we hope that this seminar has given you a little bit more of an idea about what we're doing here in the state, in our state, in order to help advance the concept of One Health. And I think increasingly we are understanding that we can't just be in our own little sections, in our own little silos. We have to get out, and even if we deal with animals, we need to talk to people who are dealing with human health on the local level as well as the state level, and on the patient level as well as the public health level as well. We also are understanding that the environments that we live in create special opportunities for either disease or opportunities for health for our animals and people, and everything works together. So we've tried to take that to a statewide level here in South Dakota. We'll keep working on it. There's always issues that come up, and we're always open to ideas and other means of collaboration. So with that, I think we will end, and we thank you very much for your participation, and be happy to answer any questions if you have any.
Thank you, Dr. Anderson and Dr. Daly. We do have a question from the audience that was typed into the chat box. For the medical students in the farm program, do they get a chance to interact with veterinarians in the community? And if so, what is the best venue to do this?
That's a great question. We have made contacts for students with veterinarians, and I know one of the students, she actually went back to a community that she was from, and early on in her farm experience, she had delivered more calves than she had human babies. But I think she was probably more the exception than the rule. But we do try to get them integrated into the community, and so they can, maybe do a ride along with a veterinarian. But I think, it varies from community to community, and, based on student interest. As far as the best way to do that, I think when I've made contact, I usually have found out who the local vet is, either from Dr. Daly or from one of the physicians in the community, because they, these are smaller communities and they usually know who those professionals are.
If there are any other questions for our speakers, please be typing those into the chat box. I do have a question for you. So just from an extension perspective, how do you guys structure the seminars that you do to make them accessible to your audiences? Are they evening type meetings or Saturdays, or how do you do that to get the most folks there?
Well, what we've been doing, and whether that's the best way to go about it or not, has been pretty much a full day seminar, not starting too early, not ending too late. So a typical day would be a 9 to 4 meeting. And we try to make the venue someplace that's pretty accessible, especially to human health care providers, and people interested in public health as well. We find that veterinarians and sometimes the livestock producers are pretty easy targets, and they'll kind of go where the meetings are. So we kind of think about, what our audience is and who we want to encourage to attend. So in our latest ones, we've utilized the conference room right at the medical school, which is attached to Sanford Hospital in Sioux Falls. So that's worked out very well. We've recorded our seminars in the past, helping make that accessible, and those are available. Some of those seminars are available on our websites. But yeah, it's hard to find the good times of year. It's always hard to find good days and times, as anybody in Extension knows. So we really rely on getting the word out broadly. We get the word out through Extension and through our previous meeting contacts in South Dakota, and we just try to structure the meetings so that everybody will have at least something they're very interested in coming to hear. So, kind of a rambling answer to that question, but hopefully it gave you a little insight onto that.
And we've had great response from the infectious disease specialists in the state. They often see the cases that are complicated or that perhaps have been difficult to diagnose. And there's only 15 infectious disease specialists in the state of South Dakota. And so I think they have a special interest in educating the public and educating family physicians and other medical providers that might be, the first line. They'll see the, patients in their local communities. And so if they have this on their radar and they're looking for signs and symptoms of certain zoonotic disease, then a patient can hopefully get treated quicker and have a better outcome.
I've been impressed with the variety of things that you guys have mentioned on the webinar today that you've done, not just the seminars, but also, presence at farm shows, stock shows, county fairs, all sorts of things. If for some of the folks that are on the call today, if they're in a state where maybe this isn't a statewide effort, what would you guys suggest as maybe, and if they've got an interest in this topic, what's something simple that they could do at the local level that might be a mini version of what you guys are doing with this One Health initiative?
One thing that I think is maybe an underlooked resource in all of our states is that person who serves as the state public health veterinarian. And so most states have one of those people, and they are very good resources for kind of knowing what the issues are and knowing what the previous educational efforts have been. So those would be very good contacts to make and at least touch base with. I found that those people are very practical and very easy to work with across the country, no matter what state you're in. So those would be good people to reach out to as far as knowing what maybe the statewide efforts are going on, and can probably kind of tie you in with people who are more local to know what other efforts might be going on, or that you can assist with.
Okay, well, thank you again, Drs. Anderson and Daly. We really appreciate your time and all of the good information. It sounds like a great program, and it was nice to be able to hear an update and learn more. And we thank you all for attending this morning. I'm going to launch the poll. I almost forgot to do that. So if you guys can take just a couple of seconds to fill that out, I'd appreciate it. And again, just a reminder, you're welcome to re-listen to the webinar this morning via the recording, which we'll post here in the next few weeks. So Thanks again for joining our webinar this morning, and I hope everyone has a great week.
Thank you.
Thank you very much.
And I will remind you, if you're still on the webinar, our next session will be Wednesday, February 6th. We'll be going to every other month. So be watching for more information from Heidi soon.